So I think what's going on with your dog is that he has allergies. So what might he be allergic to? Well, it varies, and we may or may not be able to discover right away what your dog's allergic to. But there are some common things. Probably the most common is things in the environment, just like humans. So pollens, grasses, leaf molds, dust mites, even cats and cat dander can be causing some of the trouble. There are some dogs who are allergic to fleas and flea bites. This might be the easiest kind of allergy to handle because we can eliminate fleas, whereas we can't really take away grass and leaves and dust mites from our environment. Some dogs are allergic to the protein in their food. It will cause a sensitivity reaction. And this is not your traditional human food allergy like a person who's allergic to a peanut, where they eat one peanut and they have really severe effects. This is more of an intolerance that turns into an inflammatory reaction in either the gut or the skin. And this is usually a reaction to a protein, sometimes a protein they've eaten a lot of over the last few years before we diagnose the problem. This can be a very tricky thing to find out. There aren't any really solid, reliable tests to tell us what protein a dog might be allergic to. And it's kind of a long-term trial and error where we try withholding certain foods and certain proteins or using a special food that's treated to have no proteins in it. And it can take between 1 and 3 months to figure that out. Dermatologists can do skin tests on the dogs, and those are a little bit more effective as far as finding environmental allergies. And some dogs can benefit from allergy desensitization drops or shots that are designed to reduce their sensitivity to certain pollens and grasses. Although not necessarily every dog who undergoes this desensitization always gets a lot better. So that's kind of an involved process, and that's certainly something we can consider in the future. But for the moment, we'll just talk about what we can do right now to help your dog. Now, allergies in dogs are a little bit different than allergies in most people. Most people get things like hay fever or runny eyes or runny nose, and that can be controlled with things like Benadryl. Now, dog allergies are a little bit more like eczema in people. So if you know people with eczema, they get really dry, itchy skin. They tend to scratch. They get infections in their skin very easily. And this is more the kind of allergy that dogs commonly are subject to. So, when a dog has allergies, then they're more likely to get infections in their skin and any place that there is skin. So this includes inside the dog's ears, which are lined with skin, and also commonly between the toes, around the nails, and of course on the belly where your dog has a rash. So the infection is usually not like a bad bacteria or something, or even a contagious bacteria that we worry about spreading from dog to dog. Other dogs in your house should be fine. They might have infections too, but it could be because they have allergies. It's very, very common. So if the dog has the underlying itchiness and allergy, then its skin is kind of more worried about being itchy and inflamed than it is about defending itself. And then that skin can go on to get more easily infected. The ears are a really common spot for infection because they are dark and there's a lot of moisture in there. And so it's even more hospitable for the bacteria to grow. We also sometimes see yeast infecting the skin, sometimes even in conjunction with bacteria, maybe even feeding on the bacteria. So we'll see multi-organism infections, often in more than one place on the body. So in order to treat these allergies, there's a few different levels of treatment. First of all, we need to get the germs to go away. The skin is not doing its normal job of defending itself very well. So we often need to treat those rashes and infections with antibiotics to help keep the bacteria under control. Sometimes we do this with pills or capsules or injections of antibiotics. Depending on where the infection is, we may be able to do antiseptic washes or topical antibiotic creams. So we hope that the treatment for the infections is going to be short-term. What might need to be a little bit longer-term treatment is to control the allergy at its source. So we need to correct the overactive immune system in the skin so that it calms down and can focus on its normal job of defending itself. There's a few different ways we can do this. Originally, our old standby medication to help calm inflammation down are steroids like prednisone, and they calm down inflammation pretty well, but they do come with more than the average amount of side effects. On a steroid like prednisone, you might see your dog drink a lot of water and need to urinate more often. They're often hungrier. If they're on the medicine a long time, they may gain weight. It's also hard on the liver and kidneys, hormone system, muscles. So it's not always the best answer, but it is something that will control the problem if we need it. Over the last 10 years, they have developed some newer, more dog-specific allergy treatments, and they are just as effective but can have a lot fewer side effects. So one of those we might choose is a pill called Apoquel. It's a non-steroidal anti-inflammatory for the skin. It inhibits the cytokines, which helps to block the itch cascade in the skin so that the inflammation can't continue. For dogs who don't take pills well, or for whom the Apoquel doesn't work, there's also an injectable allergy treatment called Cytopoint, which is a very safe injection with very few side effects to worry about. It can be given every 6 to 8 weeks to help control the allergy. And in some cases, just one injection of the medication will help control the allergy for a whole season. And perhaps your dog won't be as allergic once the season changes if some of the pollens change. Now, these two newer medications are much safer and very effective. They are brand name medications and they don't have competitors, so they can be a little bit more costly than the prednisone.